Hi, my name is Lynn. I'm a level 1 nursing student. Would you mind if I follow you today?
Sure.
Okay, would you mind giving me an S-bar on your patient?
So I have patient in room 231. Her name is Shanana O'Connor, 34 years old female. She's assigned to Dr. Eaglebert. Phone code. She has an allergy to cimetopram, sulfamethoxazole. She was present in the ER today at 5:30 with fever, chills, and general malaise. She reported elevated blood glucose reading and decreases appetite for the past few days and minimal urine output for the last month. She has a history of renal failure secondary to diabetic neuropathy and hypertensive uh, nephroclerosis. She has been undergoing scheduled regular for hemodialysis 3 times per week for about 1 year. Uh, Listed for transplant 6 months ago. She also has a history of recurring UTI. So when I assessed her, she's awake, alert, and oriented time 3 polar. She is tachycardia, regular RAM. I heard S1 and S1 and S2, no murmur or extra heartbeat. She has slightly 1 plus non-pitting edema in low extremities. Capital refill less than 4 seconds. Respiration, her chest expansion symmetric. All lobes clear to auscultation. Her GI, she have active bowel cells in 4 quadrants, soft, brown, and non-tender. She report recent decrease in frequency of urination and volume of the urine. Her urine has recently become more concentrated and darker in color. However, she denies pain, burning, or difficulty in urinating, no bladder distension. Her skin is warm and intact, mild dephorosis. She has a functioning AV graft on her left forearm and an 18-gauge peripheral IV in the right arm. For her muscular skeletal, she can move all her extremities normal, and she is on a renal disease diet. So when I take her vital signs, she has a elevated blood glucose. It was 155. Her temperature was 101.1. Blood pressure was 138/78. Heart rate was 95. Respiration 20 and O2 stat 96%. And she has a pain level of 4 on the scale 0 to 10, and these were taken at 7:30. Her lab results: complete blood count and differentiate count, metabolic panel, and urine culture and sensitive are pending. Her urinalysis did come back with normal pH and specific gravity. Her urine was cloudy and amber with an elevated white blood cell count of 15. So I recommend to call the doctor to report her elevated sugar level because I don't see any insulin prescribed in the EMR. And I will continue to check back on the rest of her lab results. So the doctor ordered some sodium chloride, 0.9% normal saline at 30 milliliter over an hour continuously, and he also ordered an antibiotic, which is the imipenem cilastatin in the piggyback at 500 milligram. Do you have any question for me?
Yeah. Why specifically is this client receiving this medication?
So the patient has elevated white blood cell and fever, showing a positive UTI. So this medication is an antibiotic to treat her infection.
What action does the medication have on the body?
The medication binds to the bacterial cell wall and causes cell death.
Okay. When should you question administering this medication?
So I would question administer this medication if the patient were taking any other antibiotics, and I want to make sure there was no drug-to-drug interaction.
Okay. Does the medication have a therapeutic serum level?
Yes, this medication has a therapeutic serum level of 150 to 300 milligram over milliliter.
Okay. Which vital signs must be monitored?
I think all her vital signs must be monitored, but I would focus on her blood pressure for hypotension and temperature for her fever.
Which physiological parameters should be monitored when the medication is being administered?
Consciousness and headaches.
Okay. What intervention must be taught to the client to ensure the medication is administered safely in a hospital setting?
So I would make sure the client has the right to refill her medication and make sure the medication doesn't have drug-to-drug interactions with the rest of the patient's prescribed medications.
Okay. What intervention must be taught for taking the medication safely at home?
So this medication usually prescribed in the healthcare professionals provide with the healthcare professional in the hospital setting. However, if she's continue this medication at home, I would taught her to use exactly as prescribed and take the medicine as regular interval. Do not skip doses or stop the medicine early, and do not share the medicine with other people. And she also want to watch out for any side effects.
Okay, and what would be those side effects or some potential adverse reactions?
So the main side effects are seizures and C. diff.
Oh, and how will we know that this medication is effective?
So we would know the medication is effective when she show no signs and symptoms of infection.
Okay, that's all I have.
Okay, you ready to go in the room
Yes.
for her medication? Knock, knock, knock. Come in. Hello.
Hi.
How are you?
Good. How are you?
My name is Anna. I'm your nurse today. And you have elevated white blood cell in your and your urine was cloudy and amber, so that you have a sign of an infection.
Okay.
So the doctor ordered some antibiotic and some normal silence
Okay.
for you. So are you ready to take your medication?
Yeah, that's fine.
I'm gonna raise your bed up, okay?
Okay.
Before we do that, can I verify your name and your date of birth?
Sure. Janelle Connor. I'm 34 years old.
And do you have any allergy?
Yeah, it's a sulfa allergy.
Okay. So what we're gonna do first is we're gonna give you the normal sodium chloride. But I want to take a look at your IV site. So do you have any other allergies besides the one you just told me?
Nope. Just that
Okay.
one.
So we'll clean this for 15 seconds. Do you have any pain or any irritation on your IV side?
Nope.
Okay. So I'm just gonna flush this. Everything looks good. I'm gonna scan my normal site, the sodium chloride. And I will check against the model, make sure it's the right medication, right patient, right dose, right route, and right time, and everything looks good. And the expiration date is still good, no leakage, and the color of the medication is normal. I'm gonna spike my tube. Make sure this don't touch, but they're sterile. I'm gonna squeeze my chamber halfway. Just gonna hang it over here. Make sure the clamp is closed. And now I'm gonna prime my tubing. So I'm gonna unclamp this. Like this. Unclamp on the primer to get all the bubbles out. So now I'm gonna clean the sides again before I attach for 15 seconds. Turn the system on. So channel select, and we will choose Gravel IV fluids, and this is the 0.9 normal saline. It's just asking, is it correct? Yes. So the rate is 30 milliliters over an hour. So volume to be infused. This is the 1000 milliliter bag, so I will put 950. So it won't dry out by then. Okay. I'm gonna click start. Screen is good, running, and I would put the type here for put my name, date, and time. I would document this very quick. Nice to see your armband again. Sorry, I don't know why it's exit me out. I'm just getting this again. Okay, now we're gonna hang your secondary. It is the imipenem sinostatin.
Sure.
Can I scan you again? And can you just confirm your name and date of birth again for me, please?
Chanel Connor, and I'm 34 years old.
And what allergy do you have?
Just that sulfur allergy.
Okay. So this is an antibiotic to treat your infection. However, it has some side effect. It could cause diarrhea, or you may feel dizziness. So if you have any of that, just let me know, okay?
Okay.
Also, I print out some more information about the medication you're taking.
Sure.
So you want to take a look?
Okay.
So here's the antibiotic. I'm gonna check, make sure there's no leakage. The expiration date is good. Everything looks good. And I'm gonna compare to the MAR. Is it the right drug, and right patient, right dose, right time, and right route? Okay, so now I'm gonna scan the medication. I would hang the primary lower than my secondary. I want to make sure this side doesn't touch. And I want to make sure to close the clamp. Squeeze my chamber. And just prime the tubing and I'm gonna have this run really slow because I don't want to waste any medication. Okay. I'm gonna hang it up here. I will clean this for 15 seconds before I attach this to my secondary bag. So before we administer this medication, can you tell me the 2 side effects that I told you you could have?
You said I might have diarrhea and some dizziness.
And you know you have the right to refuse this medication, right?
Yeah, but I think I want to take it.
Yeah.
Get rid of this infection.
Yes. Okay. So now I choose channel select. This is my secondary. And I want to find the medication's name. Is also right here is the independent cyclostatin. Okay. And this is the 500 milligram over 100 milliliters. Okay, it's just asking, is it correct? Yes. Okay. You click next just to confirm. And this is 1 hour. Okay. So when I put the duration in, it could tell me calculate the rate for me is 1 milliliters over an hour. Okay, everything looks good, and say verify secondary clamp open, and then press start. It's green. It's running. Yeah. I would document this. Are you feeling okay?
Yep.
And we'll make sure I count 5 drops. So 1, 2, 3, 4, 5. And also I want to put the label on this tubing, my just my name, days and age, time. And you say you have no pain, right?
Nope.
Because I have some Tylenol in your jar that
Nope.
can be ready for you every 4 hours if you have any pain.
I don't have any pain right now.
Okay. Sounds good. Okay. I wash my hands. Make sure everything looks good. I'm gonna lower your bed, okay? And you have your collar with you?
Yep.
Okay. Do you need anything before I go?
Nope.
Okay, I will be back to check on you in about 30 minutes, okay?
Okay.
You want me to close the door for you?
Sure.
Thank you. How was that?
Oh, good, thank you. I do have some questions for you. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, so I was check before I administer the medication, make sure there was no drug-to-drug interaction, and the IV, the white side compatibility. I also check for her allergy, make sure she doesn't have allergic to the medication, and I follow the 5 rights: right patient, right dose, right time, right drug.
Okay, did this information affect your decision to administer the medication?
Yes, because if the medication were incompatible, I would hold the meds and call the provider. And I would also withhold the medication if she showed any allergic reaction to the medication.
Okay, did this medication affect how you administer the medication?
Yes, if the medication were incompatible, we would consider giving the antibiotic in a different route.
Okay, that's all I have.
Okay. So just gonna document some. Do you want to follow me?
Sure.